Good afternoon, Pioneers. This is Bill Rood from Marietta College. Thank you so much for spending part of your Wednesday afternoon with us. We are here to give you an update on some of the changes that have been happening this summer as we prepare to welcome all of you back to campus and hold in-person classes in about a month. Joining me today are Provost and Dean of the Faculty, Janet Bland, Vice President for Student Life, Richard Danford, Senior Vice President for Finance and Administrative Services, Michelle Mara, and Athletic Director, Larry Heiser. I've asked each of them to join me today to help answer questions you may have about our plans for this fall and to share pertinent information that will give you a better understanding of what to expect when you arrive next month. So let's start by reviewing what we shared just last month about this upcoming fall semester. Classes will begin on Monday, August 17th, 3 days earlier than originally scheduled, and we will run straight through to finals week, which concludes on Tuesday, November 24th. That's the Tuesday before Thanksgiving. Therefore, we will be conducting classes on Labor Day, Monday, September 7th. It also means that we will not have a fall break, and classes will be held on Monday and Tuesday, October 5th and 6th. Finals week will also be adjusted. Rather than the traditional 5-day exam schedule, final exams will begin on Wednesday, November 18th, and they will be held over the course of 7 days, ending on Tuesday, November 24th. This means that each day only 2 finals will be scheduled. The first session will be held from 8 a.m. until noon, and the second session will be held from 1 p.m. until 5 p.m. Students with conflicts, as always, will have a chance to have that conversation with their professors, but no one will have more than 2 exams in any one day. Not to worry, even though there is a 4-hour final schedule, it is unlikely the full time will be used unless there are students who may have special needs. Even with COVID-19 cases on the rise around the United States, we believe we have a strong plan to mitigate the spread of the virus on campus. With everyone's cooperation, we are confident that this is the best approach at trying to complete the entire semester in person. Now I want to share some new information, as well as emphasize our expectations of everyone who will be on campus. Let me start by saying everything we are doing and the recommendations and requirements we have established are the best way we as a campus community can mitigate the spread of the COVID-19 virus. Therefore, we are asking everyone to follow the Marietta College cocktail. Marietta College cocktail is a very simple 4-part cocktail. First thing, you wear a mask. And this is not a chin guard, it's not a face guard or a mouth guard, it's a face mask. So make sure you wear it as a mask. And we'll talk later about face masks, face coverings, gaiters, face shields. There are a number of options that will be available. So first in the cocktail, wear a mask. Second, physically distant whenever possible and wherever possible. Third, wash your hands at least 5 times a day. And fourth, screen for temperature and symptoms on a daily basis. We believe if we do the cocktail well, we can limit the spread of COVID-19. We also invite members of our students' families to join us this fall in practicing that same Marietta College cocktail at your home and in your area. All of these are important, but I want to put some extra emphasis on wearing masks, face shields, or face coverings. There are a variety of masks. Masks like these. We do have masks with logos on them. First-year students will be getting some, not like this, but they say Marietta College. And then the face shield. A face shield is something that's very simple, covers your face, gives you an opportunity to have protections on the sides. You will see a number of these in our laboratories, and you will also see, as Janet will tell you, a number of our faculty are opting for face shields for a variety of reasons in the classroom. I know the face covering issue has become a politically charged topic, but it won't be on our campus. All employees, all students, all visitors must wear a mask. They must wear a mask They must wear a face shield or a face covering, your choice, at all times. Exceptions. The only exceptions to this requirement are when an employee is safely in their workspace and can easily maintain 6 feet of physical distance, and when students are in their residence hall rooms. There are also exceptions while eating and while engaged in physical activity. Once you step outside of your room or your workspace, you are required to wear a mask or face covering properly. That means covering your nose and your mouth, as I said earlier. We know many of you, especially our students who are in a low-risk age group for serious illness, feel like the virus won't have any impact on you if you get it. But now is the time to be the pioneers that we are. We need you to be responsible for your own health and for the health of each person on campus and in our community. If we drop the ball, and I emphasize we, if we drop the ball, this could have a negative impact on the semester or the entire academic year. We need you to have personal responsibility and make this semester work for all of us. We will not be asking you to go around campus in a hazmat suit, but we do expect everyone to be aware of the things you will have to do, and again, most notably, is wearing a mask and or a face covering. We need to care for each other, and wearing our mask in public shows that we do just that. Provost Janet Bland will speak about this more, but I want you to know that we are posting room capacity signage outside of each room on campus. We have spread out chairs and desks in classrooms, and we are moving larger classes to larger rooms, including the Great Room in Andrews Hall and the McDonough Auditorium. Vice President Richard Danford and the entire Student Life team have been working all summer to establish protocols in the residence halls, along with developing on-campus programming to educate our students on how to stay safe. You will hear more specifics from Dr. Danford shortly. Larry Heiser and his team are monitoring the updates that come out from the CDC, the NCAA, and the OAC as they plan for and figure out how practices and games will look this fall. As many of you may well be aware, the OAC has already decided to play conference games only in football, volleyball, and soccer this fall. Larry will provide important updates shortly. You might be starting to realize that today's town hall has a theme. It does indeed. We are trying to keep everyone safe on the campus of Marietta College. That takes me to my next request. A couple of weeks ago, I emailed all of you about refraining from any travel or vacations 14 days prior to arriving on campus. We believe that if everyone does this, we improve our chances of not having anyone arrive with COVID-19, either symptomatic or asymptomatic. Also, once you arrive on campus, we're asking that you stay in the Mid-Ohio Valley for the entire semester. I know this is a big ask, but think of the campus as being one big, happy quarantine group. Lastly, we're also asking that you not have visitors to campus and not have anybody from family, parents, friends, brothers, sisters, grandma, grandpa. No visitors should be coming unless it's essential or urgent to come to the Marietta College campus to visit. Again, I realize that this is another big ask, but we believe this will also help us mitigate the spread of COVID-19. Before I ask Provost Bland to say a few words, I want to remind all of you, if you have any kind of questions whatsoever, be sure to add them to the comments section, and we will do our best to respond. With that, I'm pleased to ask Provost Janet Bland to share her thoughts on what our classrooms will look like this fall and how we will execute in-person learning this fall for a successful fall 2020 semester. Janet?
Thank you, Bill. What I would like to talk to you today about is the issue of what is this going to look like, because that is the number one question that we're having. So we are using a variety, and Dr. Rude touched on a few of them, a variety of mitigation strategies to make sure we can safely deliver. So what's it going to look like going into an academic building? There are going to be indoors and outdoors. We are trying to minimize, mitigate the opportunities where everyone is kind of smushed together. So we want clear traffic flow. We're going to ask people, just like they do in their cars, hopefully if you're not from England, if you are from England, work with us. We're going to ask you to stay to the right in the halls. We have wide halls, obviously, in classroom buildings, and we're going to ask you to be aware of that. There are going to be clearly marked up and down staircases. Again, we are looking for efficient, clear flow. And when you're in those buildings, indeed, as Dr. Root mentioned, when you're out of your residence hall room or out of your car, essentially, we are going to be asking you to have that face covering. And I'll put in my emotional pitch. Those of you who were seniors in high school remember how disappointing it was to not finish your senior year. Those of you who are our current students, you know what it felt like to have to not return after spring break. And people felt helpless. People felt just very frustrated. We are offering, essentially in this plan, the ability to act. It's frustrating to feel helpless. We're asking you to help. These small issues, put on the mask, wash your hands. That's how, one little tiny step at a time, we make sure that we are able to continue. It's really in all our hands. So you're going to walk in, you're going to follow your traffic flow. It might not be the door you usually use, but we're going to ask you to adjust. Again, small sacrifice, big payoff. That we all stay here and we get educated and we deliver education and we're safe. So the classrooms, we're actually working on that process right today, reviewing all of the occupancy. When you think of what classes are like at Marietta College, often we have smaller, more intimate classes. But classroom buildings are essentially pretty standard, whether you're at a large university, short of not of a lecture hall, but also in the expectation of how many people will be in a classroom. So right now, over 2/3 of our classes are already able to be delivered if everyone's sitting in the class, and we don't have to split people up based on the occupancy of that room. Because again, we really don't have these giant classes jammed into rooms. We will have some situations with some classes where we're going to be moving those classes around. If there's a classroom that normally could hold 35, and I need a classroom for a class of 12, I'm probably going to ask the class of 8 to move. So we're going to be working with faculty, and that will all be updated on the schedule, so you will know where you are going. I have asked our faculty to use a variety of technological methods to be able to deliver, because while we do not want to have to go home, essentially, as we did in the spring, we have to be ready. So we have multiple platforms and multiple means by which we're going to communicate with students. You may have your class delivered in person and you're socially distanced in the class, again, based on that 50% occupancy, half of the room space, not half of the class. But your professor might say, I'm going to do my office hours via Zoom. I may split the classwork between things that are completed on Moodle or online discussions that students are going to have, and then they're going to bring those experiences into class. Your faculty are going to be working creatively to be ready, essentially, for anything. If you think about some of the experiential learning we have, when you think about, I want to be in a theater production, I have a chemistry lab, I'm taking an art class, etc. We need to be able to know how we're going to deliver that. So in spaces where we have for instance, I'm going to share a microscope with someone, we're going to do additional mitigation. I was talking to a member of our chemistry faculty who noted that under normal circumstances, long before any of us ever heard the words COVID-19, she wore a great deal of PPE in a chemistry lab. Often that's what scientists do. So we are looking to our faculty who are experts in the field, in the sciences, including athletic training, to talk about what is the mitigation that we can use if we are slightly closer together. And this is basically going to be on a scientific standard. We're also working with our music department because this is an ongoing conversation in music departments and programs across the world. There is actually pretty simple technology, for instance, for the bell of a horn, for a brass instrument, for a woodwind instrument that blocks, you don't want to play your clarinet and possibly blow virus. So there are tools like that that we can use to mitigate, spread, and still have people be able to rehearse. We have in every classroom at the podium a blocked off with plastic, you'll see it when you come into your classrooms, area so your faculty member isn't like this every moment in front of you, but that safety continues. And there will be space between you and your fellow students and between you and your faculty member. Obviously, people want to write on the board. That's why when Bill was talking about face shields, that allows people to see each other's faces. And again, we can mitigate, and we are not trapped, essentially, behind the computer podium. So what happens if someone has to be at home? We have a camera in every classroom. And training is about to begin for faculty as to what those cameras, how they function. We are asking faculty now to start looking at Thomas 202. Look at a classroom to see what you're going to need, and look at those classrooms where we are starting to put up those safety features. Every single classroom will have also a cleaning station. We are not asking anyone to clean the whole classroom. That's what our folks in physical plant are going to take care of on a regular basis. We are giving people the ability to walk into any classroom and say, I'm comfortable spraying down my desk and wiping it off, because then I know, if that's my comfort level, that I am working on a clean surface. There's no need to do anything when you leave, because then the next person who comes in would be responsible for his or her clean space. They can take care of that. So again, we're really asking for that level of responsibility. So be looking for those changes. And departments are having these conversations. I've had quite a few conversations with the theater department about what kind of productions are we going to have. How do we have fewer people on stage, but be able to still have as many people participate? What are we going to do, for instance, for education students? We have, I want to say, somewhere between 110 and 125 students who will be out in the schools. We've already started collecting face masks and face shields for our education students, and we already have a protocol that we will be sharing with them about what it looks like to go out into a public school and be able to comply with their requirements for safety and to keep our students safe. That's our entire goal, is that we are able to be here together doing our work in higher education and be able to stay safe. We'll certainly take questions at the end, and I want to introduce Richard Danford. Dr. Danford is the Vice President of Student Life.
Thank you, Janet. Good afternoon, everyone. I can't reiterate strongly enough how important it is that you pay close attention to the request from President Rood and from Provost Bland and begin to buy into the ethos that we're trying to develop here on campus this fall so that we can be successful in our efforts to remain open and deliver in-person living and learning experiences that you're all hungry for, that we're hungry for you to have, and that we're really looking forward to bringing you on campus for in August. So I would like to talk about what it's going to look like as people return to campus in August or come to campus for the first time if you're a new student and haven't been able to visit campus yet. Similar to what we did in the spring with Move Out in May, we will have a staggered and staged move-in process beginning in early August. We have a small number of students in key leadership positions who will begin their move-in on August 6th, and then, August 2nd, and their first major group of students to be moving in will be on August 6th, and that will be our new RAs, as well as our first-year students who will be participating in the McDonough Leadership Excel program. And those will be followed by other groups of students If you're a member of an early move-in group, you will know that from your athletics coach. If you're a fall sport athlete that has a group that has an early move-in, or if you're part of a student leadership group on campus that has an early move-in, or if you have a major that you're doing an internship for in the fall semester that requires an early move-in, you will know about that. What we'll be doing sometime either by the end of this week or early next week is sending you out a sign-up survey so that you will know when exactly you need to move in, and everyone will be slotted into a 1-hour window when you're asked to come to campus, and you'll know what date that is and what your 1-hour time block is. And every single student coming to campus, including commuter students, will go through a check-in process in the lobby of the Herman Fine Arts Center. And the first thing that they will do in that check-in process is to do a health questionnaire, not only for themselves, but for our residential students, also for members of their move-in group. And each move-in group will be restricted to no more than 4 individuals, including the student. This is all in an effort to minimize the number of people we have coming to campus, to ensure that they are not currently infected with COVID-19 or experiencing symptoms of COVID-19, or have not recently been in contact with someone who has a COVID-19 diagnosis or symptoms, so that, as President Rood mentioned, we can minimize the likelihood that we're bringing COVID-19 into the campus community as we open for the fall semester. The next thing I'd like to talk about is for our first year students, home. That is our first year new student onboarding experience, which will begin on August 10th with our matriculation ceremony. Typically, we do a lot of large group activity as part of that experience, and a certain number of small group activities. Every student is assigned to a small orientation group. This year, the home schedule will be much more heavily focused on those small group activities because of the limitations on our ability to do large group activity while keeping people safely physically distanced. Even in those small group activities, we're still going to be working to make sure that everyone is physically distanced, and in those situations where they cannot be, making sure that they have appropriate face covering on and are wearing that face covering appropriately. There are some real advantages to the increased number of small group activities that we'll be doing as part of home, because that's where the engagement with your fellow new students and your upper class orientation leaders really takes place at the deepest levels in those small groups. So because of our schedule this year, we'll have a little more time for home, and we'll be doing a lot more activity in those small groups. So really working to build strong community at the get-go with our new students and their upper class orientation leaders. In the residence halls, similar to what Provost Bland already discussed in the academic buildings, we'll have directional signage to manage the flow of traffic, to avoid contact with other people in those residence hall spaces. And as President Rood mentioned, requiring use of face coverings when you're outside of your room, or if you're in a suite, when you're outside of your suite, or if you're in an apartment, when you're outside of your apartment. Housekeeping will be implementing enhanced cleaning and sanitation protocols every day in all our residence halls, but we will also be providing signage and materials in common areas such as restrooms in those buildings that have common restrooms, and laundry rooms in all our residence halls, so that students can sanitize appropriately before and or after their use of that space, and so that we can manage the number of people in any of those spaces at any given time. So there will be a lot of work happening with RAs and their residence hall groups to talk about, scheduling time in the bathroom, scheduling time in the laundry room. It's not going to be as freewheeling as it would be in a typical year, but those are the realities we're in, and we need everybody to cooperate and make that work if we're going to stay safe, stay healthy, and stay open. So I encourage you all to be thinking about preparing yourself mentally and emotionally for those realities, so that we can hit the ground running in August. Dining, we're working with Parkhurst, our dining services provider, to have a strong plan in place, and that plan will be finalized early next week. But one of the key features that we're talking about is a mobile ordering opportunities so that rather than going into a dining facility and sitting down and dining, you can place an order in advance for a meal and pick that up in Upper Gilman. There will also be lots of grab-and-go meal options both in the Gilman Dining Hall and in all the other retail outlet locations that are spread around campus, so that you don't have to sit down and have a meal in one of those dining locations. You will, of course, be able to sit down and have a meal in those dining locations. There will just be a reduced number of spaces where people are able to sit, and we strongly encourage people to establish dining groups if that's what you're planning to do, so that you're having meals with a group of people that you're already in regular, close physical contact with, so that through the dining process, you're not potentially exposing yourself and exposing others to airborne illnesses that we're trying to mitigate here. The other piece of news that I'll share with you is that Izzy's is likely to be open for both lunch and dinner. That's a change from last year's operations. And the gathering place, rather than being open for dinner, will be open for lunch, because lunch, of course, is our heaviest dining period. And so we want to make sure that there are lots of dining options during the lunch hour for students where they can sit down and have a meal. And so that's what we're looking at doing with the gathering place dining option. And then we're also renting a tent and tables and chairs to be placed on the mallway to provide overflow dining space during that peak lunch hour. And then that space can also be used for classrooms, for meetings, for programming activities. And we're going to be strongly encouraging as many outdoor programming activities as we can, because that's the easiest place to keep people physically distanced and to engage in programming activities, at least while the weather is nice. We really want to strongly encourage that. The final thing I want to talk about is how we're going to be managing COVID-19 if and when we get students and or employees who receive a positive diagnosis, a positive test result for COVID-19. We'll be asking all employees and all students to do daily health tracking, so monitoring your symptoms. We'll be doing a lot of education with our students around what the symptoms are, what you need to be looking out for, and then what your next steps need to be if you have any symptoms that you're concerned about. Our Center for Health and Wellness will be doing telemedicine consultations for the initial assessment of all our students, and then based on what that telemedicine consultation reveals, we will probably need to schedule an in-person assessment if they're concerned that what you have may be strep or mono or the flu. Those are things that we can test for here on campus. If there's a concern that you do need to be tested for COVID-19, that will happen either in that telemedicine consultation or after consultation and testing for the strep, flu, and mono. And those are quick tests, so the results come back fairly quickly in our Center for Health and Wellness. So if those all show up negative, and the healthcare professionals there determine that you need to be referred for COVID-19 testing, they will do so, and that will happen at a local drive-up facility located on Pike Street, most likely. They have the most reliable tests available. There are some tests available at some other locations, but they're a variety of tests that has a lower level of confidence in terms of the reliability of the test results. So. We have been working very closely with our local health department, and we will be collaborating with them on any contact tracing that needs to be happen and supporting the needs of students and employees who need to be isolated because they've received a positive test for COVID-19, and also working with them if they have recommendations for any students or employees who've been identified by them as needing to be in quarantine until we're able to determine whether they need to be referred for COVID-19 testing, or they're still awaiting a COVID-19 test result themselves. So that's all I have for right now. I know there are going to be lots of questions, so I'll be happy to answer those. And I'm going to turn the microphone over now to Michelle Mara, who's our Vice President for Administration and Finance.
Thanks, Richard. Hello, everyone. I'm only going to keep you for a couple minutes because I know this is everyone's favorite topic when we talk about the bill. As most of you are aware, the bills for the fall of 2020 did go out electronically on July 1st. So you should all have those. If for some reason you don't see that, please contact us, and I'll give you the contact information here in a minute. The balance is due on August 1st. You've got 30 days to pay. You can either pay the balance in full, or if you need to, you can do a 4-payment plan, which means by August 1st, you need to be set up for the payment plan and have made at least a 25% of the balance payment at that time. If you have questions on your bill, you're not sure you understand it, maybe your financial aid doesn't look right to you or other scholarships, please get in touch with our student accounts area. You can do that via email at mcbill@marietta.edu, or you can email Joanne Borman, who's our student accounts administrator, directly. She's at jeb009@marietta.edu. If you would prefer to talk to someone on the phone, we have a student accounts toll-free number you can call. It's 800-274-4619. I can't stress enough how important it is that you keep your account current. It will be very important that you take care of this by August 1, so that as we start the move-in process later in August, you're all set to go and there's nothing delaying you getting started, having to be cleared, having to work out last-minute financial aid. So please, if you've got questions, go ahead and give us a call now or email us. The students are set up as users on the electronic billing. If you are a parent or another person that's involved with the student's account, you will need the student to set you up online as an authorized user. Once you're set up, you can view the bill, you can make payments on the bill, but you can't do that until that student sets you up. And if the student is not sure how to do that, again, get in touch with student accounts, either via email or phone, or if you happen to be on campus for other reasons, you can always stop in and we can walk you through the process of how to set up an authorized user or answer any questions on your account. That's pretty much all I have right now. I'm sure we'll have some questions later on. I'm going to turn it over now to Larry Heiser, who's our athletic director, so he can talk to you about sports at Marietta College.
Thanks, Michelle, and hello, everyone. Good afternoon. In the interest of trying to keep it quick, I'm going to fly through my outline, but I want to reiterate what Dr. Root talked about earlier with the 2-week quarantine before you come here. Really, Washington County has been very fortunate in that it's been sort of low on the amount of cases, and when students come back from all over the country, we want to keep it low. So football players, Coach Waddle has told you that August 7th is your move-in date. That would mean on July 24th you want to start shutting it down if you're doing anything right now anyhow. So that 2-week period will start right away for football players. Soccer players are coming in on the 13th and everybody else on the 15th. The COVID education team by team is something that we're hoping to do in a large group setting that might be a little different than what we've done when you've checked in with us in the past. So if you can imagine one of the courts in the DBRC, we're going to set that up into a huge lecture hall and have a specific COVID education meeting with each team so that you can understand how what you do can impact other people. So plan on having that as part of your check-in process. And then also get ready for daily screenings. You'll be getting emails each morning that will ask you a series of 8 yes or no questions, and you need to fill that out before you come to practice. If you answer yes to a few of those questions, we're going to ask you by the athletic trainer how you're feeling and whether or not you should even practice that day. And then when you get to practice, we'll be asking for your temperature and recording your temperature in a document that we'll save throughout the season. So certain day-to-day activities are going to have to be done every day and are going to be new processes for you. We are following NCAA resocialization guidelines, which call for activities to occur in very small groups at the very beginning. So no more than 11 people in a group to do a workout. And in addition to resocialization, we're also going to be doing a transition phase workout so that you're not going to be doing 100% of your last year's workout on day one this year. We're going to phase you in and get you back in shape for the springs that we missed out on last March and April. So 14 days of 10 to 12 in a group, and then 14 days of no more than 50 in a group, and then we can return to full practice after those 28 days have been completed. So what is going to be odd for you is that when you go back to the residence halls, those groups may disintegrate, right? You're going to run into new people. So NCAA at the Division I level has put that in, and when a football player at Ohio State goes back to his apartment right now, there's nobody else there. And when a football player at Alabama goes back to their residence hall, there's no one else there. But when you get here, you're going to be here with a campus full of other people. So we're going to put you in small groups with your team, and then ask that you work really hard in the residence halls and in your classrooms to stay 6 feet away from other people. Once we're through all those processes, we have the issue of a positive test that we'll have to deal with as well in athletics. And I wanted to just throw out there that we are not pre-testing everyone as they come back to campus as a condition for re-enrollment. That's what the quarantine is for the 14 days before you get here. If you're watching media outlets and they're talking about mandatory testings at all these Division I programs or other places, it's just not what is going to be able to happen in Washington County and in Marietta College athletics and in the whole of Division III, frankly. No one has the money to test all its athletes every week. So it's really important that you try to stay as healthy as you can and not exhibit symptoms so that we don't have to test you. We will test you when you exhibit symptoms and when your trainer says that you need to go to the health center. And then you'll fall into Dr. Danford's protocol for how all students are being handled. So I think personally that the spool of testing is starting to unravel a little bit anyhow. We're starting to hear about delays even at the professional level where they have all the money and they can't get their results quickly enough, and we're also hearing about inaccurate testing. So really keeping track of your own symptoms is the best way to go, and keeping yourself safe is the best way to go, and not relying on someone else. A couple of measures that the NCAA put in place because it's a topsy-turvy year right now is that all students will get a waiver on a season of eligibility if they play in less than 50% of that season's games. So that's a new thing that the Administrative Council put in about a week ago, and if for some reason we experience in the fall what we experienced last spring, or if we experience it in the winter and less than 50% of the season was played, no one will be charged a season of eligibility. And then that kind of brings me to the last point. There are discussions all around the country about whether fall sports are going to be played, and certainly the OAC is part of those discussions as well. So we're not ready to say that fall sports are not going to be played. We are planning to play the in-season portion that we have put out maybe a week and a half ago. But if it gets, cases are too high and the Division I teams start to shut it down and the Division II start to shut it down, we're going to have that serious discussion amongst ourselves at the OAC level. I think that's it. I think we're ready to take questions as a larger group. So the moderator will be calling us up as questions pertain to each one of us. So, Mr. Perry, you ready for the first question? Okay, so Dr. Danford's coming up for the first question.
Quick respite.
I can imagine many of the questions are having to do with residence life and things like that. So if we can start with just, you talked about a lot of the expectations, but I think it's more of the sort of what I would call after hours. Just kids gathering in rooms to study, to just get together with their friends and do things. Do we have any limits? What are the expectations of groups gathering in rooms?
The question has to do with life in the residence halls and in other spaces on campus for that matter, after hours, if you will, after classes, after scheduled meetings, that sort of thing. What are our expectations around student conduct, student compliance with our guidance? We will be asking students to limit who is in their close contact circle and only engaging with those individuals to the greatest degree possible. So that means if you are in a residence hall, your roommate, your suite mates, your apartment mates are going to be part of your close contact group because you're living in the same living environment, you're sleeping in beds close to one another, that sort of thing. They have to be part of your close contact group. Every student every year completes a roommate agreement with the other members of their housing unit, and this is one of the things that as a roommate group you're going to have to come to agreement on what you want to do in terms of who you invite into your room space, that sort of thing. People should not be congregating in large numbers in residence halls or in any other space for that matter where they cannot be safely physically distanced and or be wearing appropriate face coverings, specifically if they're going to be in close contact with one another for a period of 15 minutes or more. So those are our expectations.
Another one, just another larger gathering place being the dining hall. They were asking a question of would there be limits on how many people could be in there? I can't remember how well you explained all of the things we're going to do.
Yeah. So this question has to do with physical distancing in dining spaces in particular. Will there be limited number of seats available and that sort of thing? And the answer is yes. Our dining hall has been operating under that model since we closed for in-person instruction back in the spring. The capacity will be limited to, I think it's 175 diners, am I remembering correctly, Michelle? 50% of the capacity for that dining space. Tables are spread out, and there's floor markings to indicate where people should stand as they await to approach a station to receive their food. There will not be students serving themselves in any way, similar to those of you who've dined on campus before the pandemic know there are many self-serve stations. Those are no longer operating that way. Items will be served by a member of the dining staff.
Janet, there's the question obviously between the balance between online and in-person learning. Some people are asking, is there ability to just learn to do Zoom for every class?
The question is, what is the balance between what they refer to as online learning and in-person instruction, and is it possible to either do Zoom for every class, or I believe there was also a request of, could I just stay in my room? I can tell you that we don't want you to stay in your room. That's not emotionally healthy, that's really not good for fitness, and that's really, I don't think, why you come to college. And so the way we're going to use technology is to have a varied but sophisticated delivery of instruction. Your faculty member might say, we are going to, cohort 1, half our class, meet Tuesday. At the same time, cohort 2 is watching this on the camera. And then Thursday, we're going to switch. That may be the way that they deliver. That gives us a situation where the faculty member is not teaching the same thing twice, but it's even more social distancing. We may be mitigating to protect a faculty member or a member of the class who would like to participate as much as they can, but needs a little extra protection. It also prepares us that if, God forbid, we have to go fully online, then we are ready. That is what the training has been all summer for our faculty, is so they are masters at this, using Moodle, etc. But remember, online instruction is the type of class you sign up for, and it doesn't matter where you are, and it doesn't matter who you are, and you never see your teacher. That's not what we are offering. Hybrid has to do with different types of delivery. Dual delivery has to be sort of in a way that switching back and forth. We are not creating classes that don't require you to engage. I do not want you to just sit in your residence hall room in your jammies and not go to your class. We need you engaged in a safe manner. Can we accommodate someone who becomes ill? Absolutely. Or who needs to isolate? Certainly. But for instance, if you're in a class where you might be receiving some of the material and the interaction virtually and again synchronized during your class time, and some of it with a live faculty member, and some of it maybe there's a discussion board online that you and your other fellow students are going to be participating in. We want you engaged. We do not want you walking through Walmart watching this on your phone. We need you to be there.
Can you talk about how the ensembles will work, like choir, symphonic band, and wind ensemble?
Certainly. The question is, how will things function with the ensembles in music? Right now, your music faculty have met repeatedly, not only with the folks from physical plant, but with each other. We're looking for those kinds of mitigations, and their professional organizations of music programs and departments, are putting out guidelines to mitigate this participation. Again, to make it as safe as possible. We know that loud talking, that singing can spread, if indeed someone has the virus, it can spread the virus more aggressively. So we are looking at barriers, we are looking at face shields, we are looking at spaces and social distancing. We're looking at I had a conversation with Fred Smith, who is in charge of the physical plant today, about what does an HVAC unit, how do they draw fresh air, how does it draw fresh air in? And what's our balance when we need fresh air coming in to circulate through buildings, including Herman Fine Arts, versus the idea that if we want to be able to keep it cool, or in the winter, warm. So there's a lot of discussion about what does the safety for that look like. But we are planning on carefully and safely presenting these opportunities. You may be giving a recital, and most of the people watching it might be virtual. You might be giving different kinds of performances, and we're looking for audiences in different ways. We're going to make sure you can have those experiences. Again, when we've talked in theater about how do we perform something outside. Many of us who've been here for years remember the world's coldest, rainiest Hamlet. Okay, how do we do that? Maybe we claim that tent for a night, and that's where rehearsal or recital is. So this is the ongoing question is not, we're not throwing up our hands and saying we can't figure out how to have you sing in a vocal ensemble. We are working for the safety standards within each discipline. And there's a question for Richard Danford.
They're similar, but connected. There's a question about are there any changes or updates or things for commuter students, but then the other part of the question is cars. We still allow students to bring cars to campus and those kind of things.
So it's sort of a two-pronged question. First, are there any changes for commuter students? And second, will students still be allowed to have cars on campus? The answer to the first question is the only real change is that commuter students, just like all our other students, will be doing the daily health monitoring and recording that information and going through that check-in process earlier than they might have during other years because we're going to ask them to do that on Saturday, August 15th or Sunday, August 16th, rather than waiting until Monday, August 17th, the first day of classes. And the question about cars, yes, we will still allow students to have cars on campus this year. There's no change planned in that area.
Michelle, if you could just sort of remind them of if they have questions about the building, how that works.
Okay, so if I understand that a few of you out there are wanting to know who to contact if you have questions on your bill. You may have questions on your financial aid, but I would recommend you start with those that are in billing and student accounts. So you can do it one of three ways. You can email mcbill@marietta.edu. That's mcbill@marietta.edu. Or you can contact Joanne Borman directly, who is the student accounts administrator, and she is at jeb009@marietta.edu. If you prefer to talk to someone on the phone, we have a toll-free number that goes straight to student accounts, and that's 800-274-4619. Is that good? Okay.
President Reed, as you can imagine, there's some questions just about the community as well. As I think Larry mentioned, not a lot of cases. They understand there's not cases being on campus. They're wanting to know about the larger community, just a sense of how many cases, how do we feel about how things are going?
Oh, we feel very good. The question is, how do we feel about cases? What are the cases? Larry Heiser mentioned the numbers. The cases in Washington County have very much stabilized to the tune of about 140, 150, and we have not had a death in Washington County in the last 2 weeks, 2.5 weeks. And many of our deaths, of course, were associated with a congregate care facility. And even in the surrounding counties, in Noble County, Meigs County, those number of cases are very, very low. So the general Mid-Ohio Valley had a couple spikes in a couple West Virginia counties, But relative to the rest of the state of Ohio and the rest of the United States, the cases in Marietta in Washington County have become very, very low. And we are also know that we're very fortunate in that we have Marietta Memorial Hospital in Marietta, and we have Ken McClark Hospital in Parkersburg, which is an affiliate of West Virginia University. So we have tremendous backup for any of the issues of healthcare, of testing, of measurement, of any health issues that anybody might have. So as you come down to Southeast Ohio, you will discover that many things are open. Masks are required in many, many businesses. But again, as Larry reiterated, that's why we want to make sure on or about those 14 days before you come here, we want you to be in your own family quarantine area so that as you come down here, you're coming to an environment that is safe for everybody that you run into.
The first question, you have two here, is about the ARC, the Career Center. Will those things still, how will that be working? Is it still available? Those kind of things.
The first question is, what about the ARC, our Academic Resource Center, the Career Center, the library, etc.? We are ready to go. We may be using different means. We had a surprising success with students who wanted to work with their academic coaches in the Academic Resource Center in the spring. We had better attendance on Zoom, so yay for that. We are going to use all sorts of, again, those same barriers. We can use technology. It's going to probably be an added conversation in the Career Center is, what's the different skill set I need to do an interview on Zoom as opposed to face-to-face. We do have employers who are saying that they would like to come to campus. They're going to have to follow all of our regulations, and we will be setting up safe areas for folks to be able to distance and have that physical distance and interview. But again, we are looking to give all the same support through the Academic Resource Center. I would also note that the library, many of you who did stay on campus during the spring saw how we distanced and spaced in the library, and that will continue. But I want, in terms of following up what Dr. Danford was saying, we have space all over this campus. And one of the great things I think about being a student here is you feel some ownership to that. Whereas you might get together with friends to study the physics notes, sort of in the pre-COVID world, and you do it in your residence hall, I'm going to ask you to put on your shoes, or at least a very sturdy pair of slippers, and walk over and claim a classroom. Claim a larger space for yourself so you can distance, because you're going to want to get together with those folks, but it perhaps isn't big enough to have 6 people together talking about political science. Okay, this is your campus. You can swipe into any of these buildings, spread yourselves out, claim some space, and be able to distance and kind of keep your lives going.
The other question is, as you can imagine, the students who are set up to student teach in the fall, I just want to know if you have any answers for them as far as, is that still happening? What does it look like?
Sure thing. The question is about our education students who are set up to student teach, but I would again reference all of the students who would be in the schools. We are working with both the Wood County schools, which is on the West Virginia side. Again, for those of you familiar with West Virginia, they have a county-by-county school system, so we are dealing with one county. And both Tanya Giapicella, the chair of education, and I have been in touch with the superintendent of Wood County schools. We have also been in touch with the superintendent on this side of the river of the Marietta City Schools, and in Wood County, Washington County, on the Ohio side, there are multiple individual districts. There's great cooperation among and between the superintendents there to try to have common plans. It is their goal, obviously, to safely bring students back to school, protect students, protect their faculty and staff. What does that mean for us? That means if we're going into schools, we need to be able to, we will be asking students to sort of, we're having a discussion of the acknowledgement of what that means, that level of professionalism, to go into a school. We will be requiring that all of our education students who are out in public schools, either the very first observing that they do all the way through student teaching, that they will be complying with every single requirement that that particular school or school district has. But even if they did not have one, even if they had no requirement whatsoever, we are providing face shields for all of our students. So the students they're working with in pre-K through 12 can see them talk, see their mouths. We're finding out a lot about how we relate to each other as humans, and seeing each other's faces is a big part of it. We will be requiring, again, that kind of coverage, because even if a school, for some reason, if they said that a particular grade school, if they were unable to have students wearing masks, we still want our students protected, and we want to make sure they're not taking anything into a second or third grade class. And so we are, interestingly enough, we are also making, we have, I want to say something like in the works or current 1,500 face shields. And the first 125 that Dr. Craig Howell in physics is making for us on the 3D printer. For you entrepreneurs out there, be thinking about starting a face shield business. Those are actually earmarked for our education students, such that we will be handing them that shield to go out. So they will be minimum protected. Keep in mind, we have to follow both what the state of Ohio, because Ohio Higher Education Department is who grants us our ability to give that licensure, which while it does work in West Virginia, it is an Ohio-based licensure. We must follow their recommendations. We know if someone is not going to be comfortable going into the schools, this may well affect or impact their graduation clock, because we do not have the ability to say we will waive those requirements. For instance, to say I'm not comfortable student teaching. So that will be an ongoing discussion about if someone chooses not to go into a school, what does that mean? Likewise, if local schools were to close, our students would be participating online, and again, we would be working with the state and our accreditor, CAPE, because we are subject to their standards. This is teachings that
Are canceled, when would we know for sure?
If fall sports are canceled, when will we know for sure? Well, let's work backward from the premise that they're not going to be canceled. If there were maybe an outbreak in one of the league institutions, Marietta or Baldwin Wallace or somebody else, there's a chance that there might not be a continuation of the season once we get started. So we are actually building towards playing. If we have to go all the way back and deconstruct all that and say we're not going to play at all, and we want to give adequate notification to people, I would think August 1st would be the last possible time we would make that decision, but that's me standing in front of a podium thinking about it myself. So this is the 15th. We're in a 2-week window here of having to make a decision if that's what we're instructed to do. So, thanks.
So the first kind of question is a two-parter. It's somewhat if the number of cases were to get out of hand again, so like that, is there a plan or expectation that we'd be sending people home or doing something different? The second part of that is what would we do on campus if it was more on campus and not in the community? Would we be sending these kids back home to their communities to affect their communities, so to speak? So,
It's a great question. Really a two-part question. What happens if there is an outbreak on campus? We'll be sending students home. And the second part of the question, what happens if that outbreak is kind of concentrated to campus? Richard Danforth really spoke to that. As we see positive cases, we have a protocol that will treat those cases case by case. We'll hopefully quarantine, we'll hopefully isolate. Some of those students may be going home as individuals. Some of those students may be staying on campus as individuals. We will be working with Marietta Memorial Hospital, the local health department, the CDC, if for some reason there was a large outbreak of cases that would cause us to make some new decisions. We're not going to quote unquote shut down. The first thing that we would do, as we felt the safety was not appropriate for all the faculty, staff, and students on campus and the community, we would revert back to the same environment we were last March. We would immediately revert all our courses to online instruction, And as we move that online instruction forward, we may have to have some students that stay on campus in their rooms until we are given the sign to go forward. We may have some students that go home. We'll be very cognizant of not sending students home who may be symptomatic or asymptomatic to spread something that will go into their own individual community. So we will look at all our options, all our choices in terms of an outbreak on campus or in the community, that at times it may be appropriate to send students home, it may be appropriate to quarantine students, it may be appropriate to isolate students. And I can, again, like Larry, I'm one guy standing at the podium. I can think of examples where it may be appropriate to keep everybody here, but in a distance relationship. So I think those are the things that we will deal with on a case-by-case basis.
Just two more questions. The other one should be quick and easy, and then I'll give you the last one. There's just a question about will families be kept in the loop as testing if we have people test positive and those kind of things?
Absolutely. The question is, will families be kept in the loop as the conditions change, as students become positive? Within all the HIPAA guidelines, with all the CDC guidelines, with all the Department of Health guidelines, we will make sure that appropriate communication and information is made available to the campus community and made available to the families of the folks on campus, as well as the communication to the community.
So the last question is, you told us about the Meredith College cocktail and all those things, but are there just other safety measures you want the group to know before heading, as we get closer to that movement day?
Right. This is another opportunity. The question is, I told you about the cocktail, and the question is, are there other things that we should be telling you about bringing to campus? Now's my chance to reiterate the cocktail. Wear a mask whenever and wherever appropriate, physically distant whenever and wherever appropriate. Make sure you wash your hands 5 times a day. The answer to the question is, where does that come from? A reminder, it comes from studies of the United States military where they did tests among basic trainees, and basic trainees that washed their hands 5 or more times a day went to the infirmary 50% less for respiratory illness. And then the final one is really that personal hygiene and self-monitoring. Monitor your temperature and monitor any symptoms that might be available. The other thing, this is a chance for me to remind you what to bring back to campus in addition to what you normally bring back. We'd like every student to bring back at least 5 masks. Hopefully those masks are able to be laundered and can be laundered once a week and reused on the appropriate days. And no, we don't have a problem if you have a Monday mask, a Tuesday mask, a Wednesday mask, a Thursday mask, a Friday mask. Second thing is sanitizer. If you have sanitizer, please bring it. Be wary of some of the sanitizers out there that have been labeled not so good for you. Number 3, if you can get a hold of Clorox wipes or any of those wipes, bring those wipes with you to campus. 4th, thermometer, especially a digital thermometer that can assist you in taking your temperature each and every day. And then any kind of pain relievers, ibuprofens, those kinds of things that will be helpful as you come back to campus are things that we would remind you to come back, as we want to help you to stay safe while you're back on campus. And by the way, moms and dads, you can go ahead and mail hand sanitizer, wipes, etc. to your student. So again, we hope we've been in this last hour informative to you. Thanks again for joining us this afternoon, for all the great questions. Thanks to all the parents who are entrusting us with the safety and the well-being of their children. We aim to keep them safe and enjoying the education and learning a lot this fall. All of us at Marietta College are working hard. We are focused on making sure we have a very, very successful 2020-2021 academic year. Less than a month, 30 days from Friday. More than half the students will be back on campus, and the remainder will return in about a month in in-person classes. Beginning Monday, August 17th, depending on how everything goes during the semester, we will likely have live town hall meetings that will update parents and family members. I'm pretty sure over the next 30 to 45 days, there will be 1 or more of these town hall meetings to keep you up to date on what's going on, especially if there are changes with statewide mask policy, CDC guidelines, athletic policies. Of course, keep looking out for your emails. Have your students look out for emails, other communications from us that we want to get your attention or get information to you. We will continue to do our best to provide you with any new information as it becomes available. Know that together we're going to make this the best year ever at Marietta College. Know that our Marietta College family is amazing. Know that you all are part of that Marietta College family. Go Pioneers. Thank you so much.